So anyways, what I was saying is, in terms of like insurance companies, people do want to blame insurance companies for a lot of what the medical costs are today, and to an extent, there is some truth behind those claims. And the thing to focus on, though, is that there's three separate areas really where we've seen a massive increase in insurance costs over the last 25 years or so. Administrative bloat's one of them. Since 1975, we've seen a 3,000% increase in administrative staff across the entire medical field. In that same time period, the number of physicians has only grown by about 250%. So 250% increase in physicians, but 3,000% increase in administrative staff. At administrative staff, people think are like, oh, well, that's managers, that's CEOs. That's like 1% of that. What the administrative staff is all of the people who have to work with insurance companies, work with Medicare, Medicaid, work with government regulation, work with state regulation, all of that stuff. It's the compliance stuff, it's the negotiating. That's where all of that staff buildup has been.
Well, hospitals are popping up like crazy.
Right.
Or primary care offices, healthcare is booming.
Yeah, and that's where we've seen probably the largest increase in medical costs overall. It's regulation. A lot of it is regulation and or insurance issues, working with how we get the money from all these people. So insurance for primary care has really done more damage than it has done good, because it's just increased the overhead for all of your doctors. They have to charge more, so on and so forth. And it's obfuscated the price or the cost of actually going to the doctor. Like you were saying, I don't know how much it's going to cost me to get an x-ray. I don't know what my insurance might actually cover. But on top of that, because there's all sorts of different stipulations. Well, if it's in this situation, we'll cover 100%. But if
Which to me, that's not free market.
Right, it's not.
Why are we not allowed to shop around, understanding what the prices are for certain things, and being able to pick what we want?
And that's why my argument is for direct primary care, which direct primary care is all about, you enter a relationship, a business relationship, a free market relationship with your doctor. You might pay $100 a month, but you get unlimited doctor visits with no copay. You get, a lot of them will cover all of your lab work for free. It's part of the deal. And then all of your medications will be 10% over wholesale, which oftentimes is cheaper than what the insurance essentially would cover, and then your in that you would pay. So overall, the cost of actually your primary care would be like half to 25% of what you're paying for your insurance program now, which doesn't cover everything. You still have copays. You still have to pay 10 to 20% of your pharmaceutical costs, so on and so forth. So that's one area that we can start reducing it and getting the insurance out of the way. And the great thing about that is your doctors, because your direct primary care doesn't accept any insurance whatsoever, well, your doctors don't have to hire all those staff. They can exist in a smaller building. That keeps their overhead for both rent and staff down. They pass those savings on to you. And the cool thing about it is if enough people start switching over to direct primary care, because it's probably not all that great for lower income families, but for middle income families like us, teachers and so on and so forth, it's much cheaper, it's much more effective. And it lowers the demand on the current system. So if all of a sudden you start taking all of these people off of the insurance system, well, there's fewer people that your doctor's offices and insurance companies have to worry about, negotiating with insurance companies, so on and so forth. It lowers their costs. So then on the other end of it, people who do have insurance will see a reduction in their costs by having all of these people migrate out of that system. So you're getting a cost reduction in two different fronts. And then another third of the increase in costs that we've seen has come from pharmaceuticals. Well, where is that coming from? 25-year-long medical patents. Those medical patents are government guaranteed monopolies on the market. I create a medication, I can sell that medication for whatever price I want to for 25 years. And if there's a reformulation, well, I can generally get another 5 to 25 years out of that, depending on depending on the medication and why the reformulation was necessary. They did that with albuterol. I think I've mentioned that to you before. The CFC, the chlorofluorocarbon regulations, the ozone layer fix, we were putting all these CFCs in the air. Well, they banned CFCs. Well, even though albuterol, the active ingredient, didn't change, the FDA gave them an extension on their patent because they had to change the accelerant, the gas that you essentially suck in. Nothing about the medication changed, just the gas that was stored in it. You get that out of the way, reduce it to 5 years, and get those generics onto the market faster, well then you're seeing at least a 50% reduction in pharmaceutical costs overall. And then you want to talk about the third one, which is your exclusivity of all of the different, like your lab work, your x-rays, all of that. Well, part of the reason why those costs are so high is because your doctor's offices have the exclusive arrangement on it. Like we were saying, you can't shop around from doctor to doctor to see who has the lowest x-ray price. So they keep that cost hidden, and part of the reason they keep that cost hidden is because they know that's just going to be billed off to an insurance company. And then, they'll work it out there. So one of those things, again, direct primary care solves that problem. You don't have to worry about the cost of the lab work and whatnot because it's covered. So part of the reason why so many of these doctors' offices do all of the different diagnostic stuff they do today is for liability reasons. And that's something that, that's where that other third of the cost has come from. If you have the flu, and I know you have the flu, well now I can't just say, well, you have the flu, go take this, because if I misdiagnose that, I might get my pantsuit off. So instead, I'm going to run 2 or 3 different blood work tests, or do a strep exam or whatever to cover my bases so that I can prove it. Well, that's a massive demand on all of your different labs and everything else that have to run that. That clogs up the system, and there's only so many labs out there, so costs have gone up. So a lot of the stuff has been government-based as to why we are where we are today with medical costs. It costs twice as much for you to receive medical care here than in Australia or in Canada or so on and so forth. So you get the government out of the way, we can get this where we need to get to where people can actually afford it. And then if you want to talk about single payer or you want to talk about a government option, well then we can talk about that. But right now we're talking about a government option when we have medical costs that are through the roof. We've got to get this stuff out of the way, drop the costs, and then we can start talking about it. Because if we try and put everybody on single payer right now, it'll cost $3.2 trillion a year. That's almost double our current federal budget. We're already $1.2 trillion in the hole this year. So add another $3.2 trillion on that. We'd be adding $4 trillion to the deficit every year if we were to go to Medicare for all. That's my long rant. But I mean, that's the thing about it, is that how many people have you heard talk about that? Have you heard that in any of or read about that in any of the news things that you've read about discussing the healthcare issue?
A little bit. That really sounds like it would solve a lot of problems with primary care. Now, you still have the issue of all the other, operations, other things that are not done in primary care. If you look at the numbers, those things cost more in the United States, way more in the United States than any other country. Plus, the success rate is not as high as those in other countries. So, what you said would help fix primary care, but I don't know what it does for everything else, because you could argue that primary care is not necessarily the biggest problem.
That's a step toward in the right direction, because the administrative costs affect both hospitals and your primary care in general. So if you can start rolling back on pharmaceutical costs and administrative costs for primary care, you're doing the same thing for hospitals and so on and so forth. So that will drastically reduce costs.
Well, then my question is...
But you still need catastrophic insurance, by the way.
Mm-hmm. But is changing anything going to put a dent in, doctors' bottom line, or these professionals' bottom line? And is that going to be an issue?
It's going to hurt pharmaceutical companies because they're not going to have that monopoly anymore, right? but your doctor's offices should see their profits increase because they're going to be able to charge less, number one, but they're going to see their profits increase because they don't have all that overhead. You know, they're not worrying about all of this other stuff, the liability, the compliance, and so on and so forth. That takes a lot of money out of their pocket. It takes a lot of time out of their pocket. And you know, you mentioned the effectiveness. One of the reasons why our effectiveness in hospitals isn't as good as other countries is the way we do our shifts. You'll have a 10 or a 12-hour shift, and you might have those several days back to back. Well, what we know about sleep research, what we know about how important sleep and rest are to, especially a doctor or anybody who's doing high-level complex tasks like cognitive tasks, is you have to have that 40 hours or that 8 hours of sleep a night. When you start moving down to 7, 6 hours, 5 hours of sleep a night, and you're overworking yourself. Even the research we know about, productive work time. You have about 32 to 36 hours a week of real productive work time, and then after that, you start to see results drop sharply. Well, the way we do our hospital shifts in America today is conducive to poor outcomes because we have these overworked nurses, these overworked doctors, so on and so forth. And that is something that I don't think the government can fix. I think that's something that our hospitals need to start figuring out. KU's doing something like that where they're trying to experiment with different ways of maybe you're on for 10 hours at a time, but then you're off for 2 or 3 days. Or you're on call for 4 days out of the week, but you're on call. You know what I'm saying? Like, there's a lot of different ways to try and people are trying to start to fix that issue.
Well, that's more of a national attitude problem too.
It is.
Attitudes about work,
right,
and work-life balance.
And that's one of those things, though, too. You mentioned that, like, so many people want a government solution for things, when a lot of times it's stuff that we Americans have to take responsibility for changing our behaviors, changing our attitudes.
It doesn't take much for one leader in some kind of field to say, this is what I'm going to do, and then that can get now pushed off. For the normal American person, I say, this is what I believe. People might not believe that if they're not the ones that are making all that money. Now, it takes the leader of that company or whatever to make that push and say, you know what, this is for the better of the people, this is for the better of my workers, and this is what I believe, this is what we're going to do. And when you see that, a lot of times leaders can spur that change.
Yeah. That's part of though too, what makes the free market so great is that, okay, let's say a leader comes out in the medical profession and he's like, hey, I have done X, Y, and Z in my profession and I am making more money than I ever have. My patients are much happier because I'm more attentive to their needs. I have a fresher mind, so on and so forth. Here's what I did. No government required. He can put that out there with the internet today. This is something, maybe 50 years ago, it would have been difficult to get the word out. But now you can do a YouTube video and be like, hey, this is what I've done. And you share all that, and the market can change overnight. And the fewer regulations that are in the way, the easier it will be for those doctors' offices to do an about-face and change their practices. Which that's another thing, is a lot of the insurance requirements, a lot of the regulations that are out there, they force doctors to do things in a certain way that aren't conducive to caring for their patients. And it's one of those things that people just aren't aware of what regulations are there that are forcing their care to look a certain way. Like doctors have to see so many patients per hour depending on what insurance company they work with and so on and so forth. Well, that means you might have 5-10 minutes with your doctor before he has to move on. Instead of maybe saying taking 35 minutes with Jake Pike, and then here I am, I've got a gout attack in my toe again. Oh, okay, here's a prescription, boom. 60 seconds is all I needed. Well, insurance companies try and force you to spend a certain amount of time with each person and then move on. Get those insurance out of the way. Direct primary care, that's where direct primary care comes in. So, anyways, I don't want to ramble on forever about it, but it's one of those things that the other thing people don't consider, and you know this, when you go on and you watch actual real TV, who are your advertisers? Pharmaceutical companies. So why is it you've never heard about reducing?
I haven't watched real TV in about 5 years.
It hasn't changed. It hasn't changed. It's still, every different every different medication on the market, trying to get you to buy it.
Yeah.
The point is if a news station comes out and says, hey, if we reduce medical patents to 5 years, we could cut pharmaceutical costs in half, they would lose all their advertisers. No one's going to push that story on a commercial or large cable news company, so on and so forth. That stuff's not getting released. That's suppressed because they know they will lose advertising revenue. It's the same reason why you see Northrop Grumman every once in a while advertising on national TV. There's not Northrop Grumman is one of the largest military manufacturers in the planet. No one is buying anything from Northrop Grumman who's watching the Super Bowl. But they'll have that commercial on there, that advertising revenue, because it puts the media in their pocket. Well, if you speak out about our factory here or our workers in this state, so on and so forth, well, then we'll just pull our advertising. There's several $1 million your station doesn't get. So the media hasn't been presenting the full story on how we can reduce medical costs for a lot of reasons, and it has to do with advertising revenue. They're in bed with the pharmaceutical companies as much as anybody else.
That's all within free market laws, right?
It is. But the problem is
ethical business practices.
There's ethical business practices. But also, too, again, they're pushing for government interference.
Let's not start talking about socializing the media.
I definitely don't want to do that.
And adding regulation to them.